Hi, it's a pleasure. It's my pleasure to be here and talk about this subject that is very dear to me and my staff here at the clinic. We see, hundreds and hundreds of patients that come in with chronic pain that they've been suffering for a very, very long time. So we have put together a program that doesn't use any medicine, no surgery, no injections, that is helping our patients. And especially with our knee patients, we're able to see improvement with them when as little as 1 to 2 visits. If I don't see improvement, if I can't get you improvement in 1 to 2 visits, we don't even accept the case. So with our knees and our neuropathy, what we were just finding, so many people are just suffering. Their lives are being lost. They're not able to, enjoy their daily life other than the pain. Because a lot of people, they deal with pain. Oh, I can deal with the pain. I work through it. But it's the, I can't spend time with my family. I can't go travel anymore. And if it's a case where it's gotten really, really bad and there's neuropathy involved where you actually have nerve damage. We have cases where some people are losing bladder functions. That's time, with men, I'm seeing even things like erectile dysfunction. So these things are important because this affects not only the person who's dealing with this, but also their family. So our goal is just to give them their lives back. So we want you to be able to live your life and not just exist in it. Right. And we keep that baseline motto. And with every patient that I see, that's my goal. So I try to find out more than just the pain. What has this cost you? What has this, taken away from your life? And what do you want to gain? If you don't want to gain anything, you don't want to get that back, then we're not the place to come. But if you want to try to get that back, then this is where, we would want you to be.
Would you say knee and neuropathy, would you say that's the same?
Actually, no. Just because you have a knee problem doesn't mean you're going to have neuropathy. Okay. Your knee problem can come from a lot of different things. It can come from a past trauma, injury, chronic degenerative disease process, chronic underlying metabolic disease process. It could be coming from a chronic lower back issue that you've dealt with for years. So the knee may not, it doesn't mean that you're going to have neuropathy, which is where the nerve tissues themselves have begun to damage. And because of that damage, you're experiencing things like numbness, tingling, burning, fire, can't feel my feet, balance is getting off, you're falling more frequently. Now, does sometimes the causes intertwine or go together? And can a neuropathy patient have a knee problem? And can a knee patient have a neuropathy problem? Yes, because if they have a common cause of a lower back issue, then what that means is that your lower back can affect the knee, but it can also cause neuropathy long term. So it really just depends on that underlying cause. And that's what we look for, the underlying cause of the problem. We don't treat the knee pain and just look at the knee, because we know the neurology of the body and how that's connected. You have to look. You cannot ignore where those nerves come from. You cannot ignore the fact that there's 5 nerves in your lower back, 4 of them go down to your lower extremity. And if those nerves are being compressed at that spine, then the nerves going down to those muscles that control the knee, guess what? They're not working properly. So instead of you getting that smooth movement in the knee, you're going to start getting a torque. Okay. And in the beginning, it's just a come and go thing. All right. After a while, it's not come and go anymore. It's every day. It's getting worse. It's worse. Degeneration is getting worse and worse. To a point where you can be bone on bone. Now, we hope to get patients in before they get to that point, but unfortunately, we don't all the time. And some of them we are able to help, and some of them we are not able to help.
So is
Um,
normally the pain that people get, like say, whether it's knee pain or neuropathy, would you say that's mostly because of the blood flow? Something's clogged up, so that pain starts to build?
so even with both conditions, there's usually a problem with either decreased blood flow,
Mhm.
decreased oxygen flow, or decreased nerve flow. Definitely with neuropathy, one of those three things are going to be a problem.
Okay.
Okay. So we have to look and find out either it's one, two, or all three.
Right.
And that's what the exam comes into play. This is where you have to come in to find that out. You know, we
Mhm.
have to see if there's a problem with the nerve flow. Is it a problem with the oxygen? Is it a problem with the blood flow? Because if you don't have good blood flow, good nerve flow, good oxygen, what do you think cells are going to do? They're going to do what? They're going to die.
I am Neil Mitchell, and I am at Dr. Stidwell's office. I came here suffering from fibromyalgia and chronic back pain. Um, I've always wanted to see a chiropractor, but I never got a chance until, by God's grace, she had a voucher and I got it. I got in. She did a full exam. She let me know what was going on with me and how she can help. The treatment plan was in the beginning painful, but she explained everything to me to where I could explain it to my son. Um, it has been life changing because I was using a cane to walk with. I couldn't walk a good 20 feet without having to stop or being in excruciating pain. I still have the pain, but I'm able to do a lot more than what I was doing. I'm able to cook. I'm able to walk a little further. And it's been amazing. I hope to continue to um, keep the tactics that she's taught me and become more pain free and just have a better outlook on life itself because it was very painful. Um, it was very painful in the beginning, but like I said, they are very caring here, very supportive. They explain everything to you. They work with you. So I advise anybody who is going through any kind of neck pain, back pain, whatever it is, I advise you to come here. It is well worth it.